Welcome to A Parent's Guide to DMD. In this video, I will be walking you through the basic information that you, as a parent, need to know about Duchenne Muscular Dystrophy, or DMD. Duchenne Muscular Dystrophy is a condition that affects the skeletal muscles, typically in boys but can sometimes also be found in girls. In a normal healthy skeletal muscle cell, a protein called dystrophin ties the cytoskeleton of the cell to the intercellular space, also known as the extracellular matrix, by binding to actin filaments on one end and a protein complex called the DGC on the other end. In doing so, it stabilizes the membrane of the skeletal muscle cell and gives it structural integrity. In DMD, a mutation in the gene that encodes the dystrophin protein leads to early termination of the mRNA molecule transcribed from the gene, which means that the dystrophin molecule cannot be produced. This leads to a loss of structural integrity of the skeletal muscle cells and increased degeneration. DMD is an X-linked recessive condition, which means that as long as there is one healthy X chromosome, that individual is a carrier for the condition and not afflicted by it. Because boys only have one X chromosome, which they inherit from their mothers, and a Y chromosome that they inherit from their fathers, male carriers are always affected by the disease. A typical timeline of a patient with DMD begins early in life. In the early phase, nothing is out of the ordinary and babies hit milestones as a healthy baby would. At 4 months, they can roll over, which is typical. Symptoms can be difficult to spot in this stage since patients do grow, but you may notice that your child is slower in walking, talking, and sitting, and gets tired more easily. In ages 6 to 9, as their quadriceps weaken, they will have much more difficulty doing things like walking and getting up. You might also notice that they walk on their toes and appear wobbly as they walk. This is around the age that they would begin to develop heart problems. Through ages 10 to 14 is when the patient will require wheelchair assistance and develop scoliosis, and in adult life, breathing difficulties and severe lung conditions will develop. There is currently no permanent cure for DMD, but early clinical intervention is extremely important, as beginning treatment early can significantly slow down progression of the disease. Furthermore, you may want to take your child's diagnosis and your or your partner's status as a carrier into consideration while planning for more children. During the process of diagnosis, your doctor may choose to conduct a muscle biopsy, which, if DMD is present, would most likely show atypical features such as central nuclei in cells and extensive muscular fibrosis. There are currently a handful of treatment options for DMD based on the severity. These include steroid treatment, stem cell therapy, and gene editing therapy. Each come along with their respective benefits and side effects and should be decided upon speaking to a physician. It is important to remember that alongside physical issues, patients may exhibit learning and behavioral problems such as delay in speech, ADHD, anxiety and depression, aggression, and autism spectrum disorder. Because of this, it is important to create a wholesome and supportive home and social environment for your child, especially because they may already feel isolated due to their differences from their children. It is important to always remind them that they are loved and that their differences make them by no means less important. I hope you have found this video helpful. However, please bear in mind that medical advice should always be sought from a medical professional. Thank you for watching, and I wish you the very best.